The following is a segment from a Mutare-sponsored webinar on the FCC's Hospital Robocall Protection Group findings, detailing the specific threats and actions needed to combat fraudulent robocall activity within healthcare organizations. Visit our YouTube channel for the full presentation.
So what is a hospital to do, or what are the best steps on coordinating with federal and state agencies, and how do they know when to engage with that? I think that's the part where things, I know for me, become a little bit more cloudy on what exactly do we do, and who really. Sometimes it feels like, does anybody really care about this problem that we're having? Like, will they care that we're having an issue? Do we sound like we're just complaining about robocalls? Kind of talk to from your side, because I know that you've worked on that side of the collaboration and the coordination that is there with the federal and the state level of what do the hospitals do now that they have this information and need to tell someone. What's been that experience?
Again, I think it's incumbent upon the hospital to identify the calls, the nature of these calls, right? That they're actually being victimized by disruptive or unlawful calls. And then I think it's important for the hospital, the next step is to document the impact on that the call has had on care delivery. It makes a much more compelling case for when they do go to the regulators and law enforcement and say, look, these calls came in and they tied up our nurses' station lines. And as we were waiting for lab results and we were waiting for other information and trying to communicate with patients to tell them to come in for elective surgeries, or suppose you have a very significant lab results you're trying to communicate to a patient, and you can't do that in a timely manner because your phone lines are unavailable because of this. So I think documenting the impact to care delivery disruption, and then just like as we recommend for any type of incident response planning, is really the time to have those conversations with state, federal regulators, law enforcement is before an incident. You don't want to be in the midst of a crisis trying to figure out who should I talk to and who do I trust to talk to? Who do I have that personal relationship within the government that I can relay this, that it will not generate some onerous regulatory audit upon us, and we don't want publicity. We don't want this to go to the media. Who do we trust? So just as in a cyber incident response plan, those trusted contacts in the appropriate agencies should be identified, actually listed in your incident response plan, and they should have a copy of your plan as well. So that's what I would say. Make sure they're identified prior, make sure they're available during, and then continue the conversation after the incident to make sure there's appropriate follow-up and emphasis placed on the incident.
And John, I think just naturally, I am seeing the logo over your shoulder there, and it, and your experience that, even from AHA, how serious they took that with bringing someone like you and your background and experience into the association to bridge that gap. So I would assume that, a great place to start is with AHA with regards to how do we engage?
Thank you, Rebecca. I appreciate that for that plug for us. But yes, any hospital, member or not, I always make myself available for any hospital or healthcare entity experiencing any type of attack. I'm available literally 24/7, and I do give my cell phone number out actually to folks, and if they need to contact me. But for now, I'll just say contact me at jriggi, R-I-G-G-I, at aha.org if you ever need any guidance or assistance on this type of issue. And old habits die hard. I monitor stuff 24/7.